So in order for us to understand what's happening in our body when we have pain, we need to understand a wee bit of the role of our nervous system. So as you can see from the slide, we have a picture of our nervous system and then a more magnified picture of the central nervous system. So we can see that our nervous system is made up of a peripheral nervous system and a central nervous system. The peripheral nervous system is our long nerves going from the outside of our body in towards the spinal cord. And then the central nervous system is made up of the spinal cord and of the brain. At the end of our long nerves, we have nerve receptors or nerve endings which bring in lots of different types of information into our nervous system. This information is information about changes in temperature, changes in movement or pressure, for instance, how comfortable you might be feeling right now whilst you listen to this presentation, and any chemical changes within the body or out with the body, for instance, a wasp or a bee sting. We have these nerve receptors all over our bodies, and they are constantly bringing in information into our nervous system. Once the information travels through our nerves as an electrical impulse, it then reaches our spinal cord, which you can see in the picture. And depending on how important the information is, it can then be sent on to the brain for further processing. The brain essentially decides what to do with the information. So let's take the example of a hot kettle. If you were to put your hand on a kettle with steam coming out the spout, you'd immediately feel a sensation of increased heat, likely pain, and you'd pull your hand away. So if we then think about what happens within the nervous system whilst that's happening, the nerve receptors are bringing in information about the change in temperature. This is deemed important by the spinal cord, which sends the information very quickly towards the brain, and the brain responds by giving you the sensation of pain, but also by withdrawing your hand from the kettle. We also understand that some information isn't passed on via the spinal cord towards the brain, and if we then think about an example of a bruise, perhaps you've been in a situation where you've seen a bruise on your arm or on your leg, perhaps once you've got out of the bath or shower, but you can't remember where you got it from. So at the time of the injury, that information wasn't deemed important or useful at that stage for the spinal cord to send that on towards the brain, and therefore at that stage we didn't have the sensation of pain. So essentially what we're saying is that we require the nervous system in order to generate information from the periphery via the spinal cord towards the brain, and the brain makes that final decision about all the information that comes through, and one of those decisions it makes is an output of pain. So do we ever think that pain can be useful? Perhaps we already understand how useful an acute pain is because we've got that protective role. So let's have a wee look at when it is useful. Looking at the pictures that are on the screen, you might identify with a time when you might have sprained your ankle, twisted your knee, staved your finger, and you'll remember then what happened as part of our body's protective response. Perhaps you remember that the area became swollen or red, tender to touch, perhaps it was hot. And this is because all the chemicals that are involved in the healing came to that area. We call this inflammation, and it's a very normal process within the body. The chemicals that are part of the inflammation process irritate those nerve endings that we spoke about previously and make that area tender to touch because that information has been sent via the nervous system towards the brain. We understand that this reaction of tenderness has a protective role. It means that when you have a sprained ankle, we tend to rest more. We might even use crutches or a stick for the first day or so, and that allows the injured tissues to heal and have that time to heal. As the healing process takes place, we can then walk a little bit more, perhaps then we can jog, and later run. And finally, in a few months down the line, we might have forgotten that we had the injury in the first place. So we can probably argue that there was a useful reason for the pain. It meant that we rested the area and allowed the tissues time to heal. As the healing process takes place, the chemicals are then no longer needed in that area of injury and stop being released from the tissues. And then they no longer irritate the nerve endings, and so there's less information travelling through the nervous system. So when the chemicals stop, the pain should also tend to stop. We know that the process overall takes a bit of time, but the tissues do heal, and the body's very good at doing this. We know that we can't make our skin heal any faster. But we also know that we can predict tissue healing times for muscles and for bones and ligaments, for talking's sake. And if we went along to see our GP or our physiotherapist with a minor injury, they're usually able to tell us how long it might take for the swelling to settle down, when we might then be able to move the joint better, and that in a few months' time that things will settle altogether. So perhaps now we can agree that in this situation, pain is a useful process. But we might also question whether the pain always goes away. For some people that have had an injury like this, the healing process takes place, but the pain doesn't go away. And that's when we can sometimes then think that our nervous system and its processing is starting to go wrong. So why does the pain persist in some instances? What do we know about that? And it might seem a very obvious thing to say, but pain is not a simple thing, especially when it's been around for a while. It can become more complex as time goes on, and this is perhaps something that you recognise for yourselves. We also understand that pain is an experience and it's individual to everybody. We can hear from some people that we see that because their pain is not visible, then they often feel that sometimes they're not believed. And if you try and do things that enable you to live a normal life, other people might then think that your pain has got better or it's no longer a problem for you. What we know is that we can't feel each other's pain, but that doesn't mean that it's not real, and therefore we know that your pain is what you tell us it is. It might be quite natural to conclude that if your pain is ongoing, then there must be ongoing tissue damage. However, we know that this is not always the case. We know that some people who have had surgery, for instance a joint replacement, have a new prosthesis and therefore no further inflammation, but some of them still report pain. We also know that many of you may have had lots of investigations for your pain, like MRI scans or blood tests or x-rays, but you've been told that there's nothing wrong with your tissues. Or perhaps what they have found, they can't relate to the pain that you're experiencing. And that might maybe make it quite difficult for you to understand. Some people have had pain with normal investigations, and other people have many changes on their MRI or their x-ray, but yet report no pain. And again, that can sometimes conjure up feelings of being disbelieved or feeling like people are saying that your pain is not real. However, we know that this is not the case. We know that your pain is real. If we then look at the examples of the pictures that we've got on the screen, the top the picture there is an x-ray of a gentleman's hand who he unfortunately managed to fire a nail into with a nail gun. If we saw this person in front of us just now, we'd expect to see lots of blood. Perhaps the gentleman would be holding his arm and his hand, and we'd probably expect him to be saying it was very uncomfortable and very sore. But yet the story behind this gentleman is that he worked on a building site, and when he put the nail into his hand, he tried for a while himself to get the nail out and didn't manage, and then asked some colleagues to help, who then encouraged him to go to see A&E. And when he got to A&E, the nurse that was doing the triaging expected that he was going to be uncomfortable and encouraged him to have some painkillers, but he didn't report any pain. And he said he just wanted the nail to be removed, the area to be cleaned up, so that he could get back to work and earn money again. And if we compare that with the bottom picture of a paper cut, which I'm sure we've all had, sometimes it's so difficult to find it, so there's not very much tissue damage, but often we would report it's nippy, it's really uncomfortable, it's sore. And again, we might only notice that if we were cutting up fruit or using the alcohol gel in the hospitals. But if then we understand that this person is a professional violinist who's due to perform that evening, that level of pain might be very different for them. So I guess what we're saying is pain doesn't always make sense, and it doesn't always relate to the amount of damage that we've got going on in our tissues and in our body. So how else might we explain that? So what we know is that when pain is ongoing, there are changes that happen within the nervous system in terms of the processing of the information. We know that you've come along towards the pain service because you have pain that's long lasting, and we know that that could be for different reasons. Perhaps you've had an injury or surgery, or for lots of people we see pain has just started for no obvious reason. Whilst we don't know why you've gone on to develop long-term pain, and others we see elsewhere haven't, we know a lot about what happens within the nervous system when we have persistent pain. We know what happens almost when the nervous system processing goes wrong. So if we remember back to the slide that we talked about a wee while ago about a normal processing of the nervous system and understanding that pain is an output of that system, if we then look at this picture and understand that pain is already an output, because for you it's long-standing, then when the pain persists, the brain wants all the information it can get from the area that it sees as dangerous. So the nerve receptors in those areas start to change a wee bit. They become more sensitive, and the threshold for the electrical information to fire up the nerve starts to come down. So essentially they bring in more information into the system. It doesn't take as much for that nerve to fire and send the message along the nerve. The brain also creates more receptors. They're woken up and they start firing to bring in more information as well. So what we can gather from that is that this results in more information or messages being sent towards the spinal cord. And because there are more messages going to the spinal cord, it becomes much less selective. It lets more messages through than it would have done in the past. So therefore there are more messages getting to the brain, and the brain gets quicker and better at recognising these messages. And because it's concerned about these areas, then it continues to produce that pain as an output. Often we can say that this is like a vicious cycle is developed within the nervous system. If we then think of our nervous system as a protective system, as we understand pain is linked to our protection, it can be a bit like a house alarm system, which in ordinary circumstances should only go off if a window gets broken or a lock is forced. But a lot of people who suffer from long-term pain tell us that their alarm system goes off even if someone just knocks at the door or walks by their window. They say that they get a large amount of pain from quite a small amount of movement or pressure or temperature change. Perhaps that sounds familiar to you. Perhaps how you understand that is that the walk to the shops now is harder and more painful than it was in the past. It's almost as if your alarm system is on high alert or it's sensitized. And some people describe this like feeling bruised all over when someone gives them a hug. And that's difficult for other people to understand when we know that pain is not always visible. But we also see that when people have pain for a long period of time, they change their habits and postures, and it can happen without them realising it. Perhaps you've noticed you've become a bit more protective or even worried about the area of pain. You maybe stop touching it or even moving it. This might result in you spending more time on your own or hiding yourself away. Or maybe you do the opposite and you try and overcome the pain by pushing through. And we'll talk about this a wee bit later in the presentation. Some of the strategies we introduce within pain management physiotherapy are directed towards retraining this sensitised nervous system. We know from earlier on that we said that we don't have techniques or approaches that can completely get rid of your pain, but it is possible to dampen down this sensitivity to allow you to do more of the things that you find important and that you want to be achieving in life. We also asked earlier in the presentation, are there any factors that can affect our pain and our experience of pain? And we understand that pain is definitely one of the sensations we get when our nervous system is sensitised, but you might have noticed other sensations as well. Perhaps you've noticed numbness, or pins and needles, or burning. And other people describe unusual sensations like water trickling or insects crawling under the skin. You might be able to relate to that, or you might not have ever felt these sensations before. But it can be a relief for some people to know that the sensations that they feel are part of a sensitised nervous system. And therefore we would encourage you to tell us about these sensations if it's something that you experience. If we also think about our previous experiences of pain, then they can also affect our perception of how dangerous the pain is in the future. If you have a flare-up, perhaps, and this flare-up means that you are unable to do the things around the house that you would normally do, or you need to ask for more help, or if you're working, you need to take a few months off. When you next have a flare-up, it's likely that you're going to be concerned that this will repeat itself and happen again. Or perhaps if you suffer from fibromyalgia, for instance, and you know somebody, a friend or a relative who also suffers from fibromyalgia, and they find it difficult to dress or to wash themselves, do you worry that this is going to be something that you are concerned and worry about and struggle with in the future? If we think about your emotions, do you think this has an impact on your pain? What we understand is that there are areas in the brain that are active when we experience pain, and these same areas are active when we are stressed or anxious, depressed or angry. And this can feel like there's an increase in the pain to 100 watts when we're stressed or low in mood, compared to it normally burning at 40 watts. Perhaps you've experienced this, that when your pain feels worse, when you're stressed or anxious. On the other hand, your pain might seem less severe when you've had good news, or when you're at a party or on holiday. We also know that chemicals are released when we're anxious, and these irritate these nerve receptors and nerve endings that we were learning about before, and that causes them to send information through the nervous system. Therefore, sometimes when we treat anxiety, it can also be a helpful approach to tackle our pain. What about family or friends? We often hear from people that they can either be very, very supportive or not very supportive at all, or perhaps somewhere in between. And when they're very supportive and they wrap you up in cotton wool and don't allow you to do things for fear of increasing your pain, that's not always helpful. Because people say that they feel they lose their independence and their sense of their role in life. But then it's difficult if friends or family expect you to do everything as normal, despite the pain that you feel. And by trying to fulfill that, we know that people can feel more pain as a result. So often the approach of, I'll be there if you need me, is what people report to be most helpful. If we think about conflicting information from health professionals, I'm sure some of you would report the fact that you have had conflicting information from people that you've seen. We know that people who come along to our pain service have often seen a number of different specialists before they come. And I'm sure that they've not always said the same thing to you. Sometimes the advice doesn't add up. Sometimes you might have been told to be as active as you possibly can, whereas someone else might have said, you need to be a bit careful about how active you are. Or maybe you've been given information that doesn't quite make sense. We've heard from people before that they've been told by different professionals that they have degenerative changes and wear and tear and osteoarthritis, and they've been left thinking that they have 3 different diagnoses, but what they didn't understand was that it was the same diagnosis. And this can be confusing. We also understand that appointment times can be short, and some interactions can be challenging with professionals. And therefore it's difficult to understand the information that you're told during those consultations. And within the pain service, we have the luxury of a bit more time with you, and therefore time to expand and explain information that we might give you. If we think about work, and for those of you that are working, perhaps you can think of them either as being very, very supportive or not supportive, a bit like the family and friends scenario. And this will have implications for how you might manage your pain at work. Perhaps you might be self-employed, and therefore having persistent pain can be very stressful, trying to balance the books and keep the work coming in alongside managing levels of pain. If we think about understanding your pain and having an understanding of your pain, knowledge is power, but we also know that we can resort to Googling symptoms sometimes, and there can be lots of helpful information on the internet, but also lots of unhelpful information. Often we're given the worst case scenario, and it can be very difficult to know where to look for information. So we've popped some websites at the end of our presentation for you to explore, and this is information that we would encourage you to access from reliable sources. This will perhaps enhance your understanding and knowledge about your pain. So what we understand overall is that there are many factors that affect our pain, either directly or perhaps indirectly. But this can get in the way of how we manage our pain better.